Hello, everyone. Welcome back to another episode of Testimony Thursdays. I'm your host, Dr. Jazz, physical therapist, child of God, mentor, daughter, sister, auntie, all those good things that the Lord has blessed me with. And of course, we're going to go ahead and get started with our devotional. So today is May 1st, and it says, "You are on the path of my choosing. There is no randomness about your life. You now compromise the coordinates of your daily life. Most people let their moments slip through their fingers, half lived. They avoid the present by worrying about the future or longing for a better time and place. They forget that they are creatures who are subject to the limitations of time and space. They forget their creator, who walks with them only in the present. Every moment is alive with my glorious presence to those whose hearts are intimately connected with mine. As you give yourself more and more to a life of constant communion with me, you will find that you simply have no time for worry. Thus, you are free to let my spirit direct your steps, enabling you to walk along the path of peace. And the scriptures are Luke 12:25 through 26 and Luke 1:79. So I'm excited, especially for that last part, enabling you to walk along the path of peace, because we have Dr. James with us today, and I am so excited to hear her story and all of the wonderful things that she is doing within the physical therapy world to help people walk again and help people regain their independence. So, Dr. James, if you could introduce yourself.
Hello, everyone. My name is Dr. Chanel James. I am the owner of Limbs and Things. We are a mobile and telehealth physical therapy practice. We serve aging adults in DC, in Maryland, and in Virginia. And our goal is to help you move from whatever you can't do to being able to do it. So from I can't to I can. You want a little background? Okay, so I am a graduate of Alabama State University. I'm a native Washingtonian. But I graduated from Alabama State in 2009 with my bachelor's degree in recreational therapy. So I like to do all the fun group activities, but also physical therapy. I graduated in 2012. So I went to the same school twice just to make sure. Initially, I went there for physical therapy, but I found that recreational therapy was a good track to go into physical therapy. So now I try to merge the two with therapy in people's homes.
Dr. James, that is wonderful. I love that. I love recreational therapy. I love having fun. And yes, the merger is amazing. So I want to start with a little icebreaker. I have a question. What is one thing you wish people knew more about the physical therapy career?
I think the main thing people don't know is that we know about the whole body, not just the aspect of walking. And that walking encompasses the entire body. But from the aspect of, so limbs and things says like one of the taglines is from the inside out. And so I had a lot of people ask, like, well, what are we doing with the inside that affects the outside? But all of those muscles are connected to nerves, and all those nerves are innervating those muscles. Then we've got the blood vessels going through that. And if any of those stop working properly, then you need a physical therapist to help you move better. So, um, knowing what's happening on the inside to be able to help someone on the outside is one of the things that I think people need to know. But for physical therapists in general, I think so many of us go in one track. Like I want to do outpatient, or I want to do acute care in a hospital setting. But it's so broad and a topic or a career that you can switch careers within the same career. So that's one thing that I think people need to know.
Yes, yes, I 100% agree. And I talk about that a lot that, once you get in through the door with physical therapy, like how you said, you can literally switch careers. Like you can go from working outpatient ortho to working pelvic floor or working inpatient rehab or aquatic therapy. It's just so
Mhm.
many different things that are needed within the career field. So I feel like we can never get bored. But
Exactly.
yeah, it's so much fun things. Can you tell us more about Limbs and Things? How did you come up with that name? What made you want to go into entrepreneurship? And how many patients do you typically see a day? I know that was a lot.
Okay, so Limbs and Things, there used to be a store around called Linens and Things. And I liked the name of that store. I had been saying that name probably before I went into physical therapy school, but the term limbs and things comes from seeing things from the inside out. So the limbs that we all see, our arms and our legs, but the things are all those things inside of us and what helps those things to move or those limbs to move. So that's where the name came from. You asked how many patients I see a day. Usually it's 4 to 5, and it can be 6, but that's a hard day, and that's a longer day. If it's 4 to 5, then that's tolerable. That's one of those we can make it through the day, and we're not working too late or too early. Because I want to make sure that I have a good balance between working and home life. But you asked one other question. Can you reiterate
Yeah.
it for me?
I did ask one other question, but I'm gonna interrupt you real quick. I
Okay.
was just on a meeting for one of the advisory boards I'm a part of, and
Okay.
we had someone who was talking about just preparing students for the workforce, and he was saying how we need to be harder on our students. Their last clinical rotation needs to be the toughest. We need to be more mean because when they graduate, they're not just going to be seeing 6 patients. They're going to be seeing a full caseload a day. And I was like,
It depends on your setting.
I see my full caseload is 3 patients. Like 6
Yeah.
is wild. So like I called my sister and I was like, girl, what is going on? And she was like, yeah, like I saw 6 patients today, but once again, like that's a hard day. That's her trying
Mhm.
to increase her income versus see, I can't even that doesn't even like what? Because
Yeah.
I'm giving the best to my patients. And even for me, like when I go see my PCP and stuff, I try to make sure my appointment is like in the morning, like maybe late morning, because I don't want you burned out by the time you get to me. You know,
Yeah.
talk to people. I can't sit and have no, I need to have an in-depth conversation. I need to make sure that I am your main focus while I'm here. Um,
Hmm.
so thank you for saying that. But
Yeah.
yeah, my last question was what made you want to go into entrepreneurship?
That's right.
Yeah.
Okay. So I've always wanted to be an entrepreneur. I was given some advice when I first started the process of PT school and getting out into the workforce that you shouldn't be a travel therapist and you shouldn't do entrepreneurship right away. Um, those things or words of advice are not something I would actually share with someone else. I did travel therapy initially, and it ended up being a great opportunity to see the world, but also to see the different settings of physical therapy that's available. And especially when you don't know exactly what area you want to go into to spend like all of your time. It helps you to figure out, okay, maybe I do like this setting, but I'm ready to make a switch and it not be something detrimental or something that requires a big uplifting or upshifting of your life. So travel ended up being great in that regard. And then entrepreneurship. So kind of COVID related in terms of there not being a lot of options at that time. I had just had a baby at the beginning of 2020, and I was about to get back into the workforce about March. And that's when everything was kind of full blown with COVID, everybody staying home. And so I had started the process in 2018. However, I didn't get out into actually doing the work of it full time until 2020. So I feel like it was a COVID push to go into entrepreneurship full blown because I was trying to do baby steps toward it instead of going full force into it. So Limbs and Things has been in practice for 5 years. It's May of 2026. So we started in May of 2020. So 6 years as of this month.
Happy 6 year anniversary. Thank you for sharing that. What
Mhm.
I'm hearing is a common pattern that COVID really like birthed some really great business ideas, sustainability, creativity. I have a lot of guests on here that say, I got started during the pandemic, all these ideas came up. Or, I got that push of like, okay, I know that maybe working for someone else is not always reliable. So I had to create an income, a stream of income on my own. So Yeah, I'm glad that you are obedient to the calling because 6 years later, you're still going, you're still thriving. Um,
Yes.
how many like therapists do you have working for you, working with you, and then do you do other disciplines?
No, so I am the physical therapist, and no, there are no other disciplines, it's just physical therapy. Hmm.
Do you have other physical therapists too that work alongside you?
No.
Okay, not yet,
Hmm.
not
Not
yet.
yet.
Wow, that's
Mm-mm.
yeah. So you're staying pretty busy.
Yes.
What would you say was the most shocking thing you learned about being a business owner? Because it can be kind of scary.
Um, I think the most shocking thing is that we always think that people know what you do at the beginning. You think that if people know that you are a physical therapist, then they're going to just want to do business with you. But the marketing aspect is big. Um, you do have to put yourself out there in more ways than one in terms of like going to different events that you may be around people who can assist you, not necessarily the people, but the ones who can lead you to the people. And then word of mouth is big, social media is big as well. And then making connections with people who you wouldn't necessarily think are like a direct line of contact. So, like social workers, for me, prosthetics and orthotics companies. Sometimes it's knowing someone else who owns an assisted living facility. It can be people who own home care companies, and it could definitely be the people that you go to church with. It could be the people who are in your household and they just know other people. So we see mainly geriatric patients. And so people who are older, they like to get on the phone and they'll go tell so and so and tell another person. And then it's like a snowball effect. So we've been really blessed in the fact that we haven't had to do like tons of marketing, but the marketing that we've done has been strategic enough to keep us afloat and keep us even better than afloat. So I'm grateful for that.
Yes, so strategic planning and word of mouth. Yeah, that
Yeah.
helps out a lot. That's shocking to me too. Like, I feel like the more I work, the more I'm like, oh, people know what PT, what we're doing, why I'm coming to your home. Because I do home health as well, and I work
Hmm.
in geriatrics and pediatrics too. And recently I went into this home, and when you're doing home health care, you're kind of like that primary care provider. So
Absolutely.
company, like we go over medications, we go over vitals,
Hmm.
blood sugar levels, all of these things. So I'm sitting down, I'm doing like the start of care, I'm going over all this paperwork, I'm going over medications, and I'm teaching them literally like how to use like a glucometer and all of those things. And when I discharged them, the client's husband, he was like, "This is the first time like I had somebody be thorough with my wife's healthcare, like just even going over the list of the discharge medications or why her blood pressure was dropping. It's like, yeah, because she's taking two blood pressure medications, or talking about how exercise can influence their blood glucose levels, all of these things. And he's like, no one ever like was that in depth with our conversation. Like you really went above and beyond explaining all of her health conditions to me. So it's like, yes, like, we smart, man. Like PTs, we are smart. Like we're so intelligent. We have so much to offer, and we have so many different tools in our toolkit. So that made me very happy. But can you tell us about a story about a patient that like you'll never forget, something that was just a miracle, something that you're proud of to be a part of their journey? I love hearing stories like that.
The first one that comes to mind is a patient who had a below the knee amputation and he had a two-level home and he had his bedroom upstairs. His wife lived with him, but he was mainly on the initial floor because he could not go up and down the stairs. And so um, I was telling him that's not a way to live. We need to be able to live throughout your entire house. And so we worked on bumping up the steps, being able to hop up the steps until we worked to having the prosthetic on that sound or the residual limb, and then being able to actually step up the stairs. To me, the best part of that story was the fact that he told me one day after we had practiced all of that, I'm now sleeping upstairs. I can walk up and down the stairs and I feel confident that I can get up there and enjoy my house again. And I don't have to stay in this one place. But then, in addition to that, he would tell me things that he wanted to do and what he wasn't able to do because of this amputation. One of which was drive his sports car again. He used to be a personal driver or chauffeur for a lot of different companies. And that was like his livelihood. And so he wasn't able to get into a car. And so before or like graduation day, that's what I call it. When I discharged somebody, we got in his car. He drove around the block and came back, and he was able to get in and out of it safely. And it was just really a testament to the fact that if you work hard at it and you listen to your patient and what they're really wanting to do, it can help them to see their potential and they can actually achieve it.
Is that is wonderful. That is amazing. Like, and yeah, like how you said, that's not a way to live. Like, that's your home. You've been living at home for probably so many years, and then you have like a life altering event, and you just want to be comfortable in your homes. Like, that's your peace.
Yeah.
That's where you spend most of your time with your family. So, yeah, I love doing home care because yeah, that's so fun to me.
Yeah.
Um, Even with the bumping, like knowing that as a physical therapist, like trying to bump up the stairs. My line sister came to visit me when I was doing travel physical therapy in Arizona, and
Okay.
we were on the electric scooters, and she ended up falling off, breaking her ankle. We was on there for like 5 minutes. And we got to the ER, and the ER was like, "That's electric scooters are like terrible. We get the most injuries from electric scooters and all this and that." And I was on Google, and I was like, "I didn't know electric scooters were that bad." But she ended
Mhm.
up with an ankle, and we were staying at this nice hotel, this nice resort in Arizona. But we had stairs to get into our room, and she was like, "How am I going to get up these stairs?" And I'm like, "Girl, you're gonna have to sit down and like bump up the stairs." Like, it was just so wild. But just having knowing that piece of information and how we can help people is wonderful. So
Mhm.
yes, I have two more questions. I'm not gonna take
Okay.
more of your time. My other question is, how do you handle patients that they're ready to graduate? You know that they're ready to graduate. The family knows that they may be ready to graduate, but they just love you so much. They want you to come see them and talk to them and do exercise. Why you can't keep coming and do exercises with me? How do you handle those type of patients?
And that's hard. It's always a challenge. I will say at the beginning, I did not handle it well, from the standpoint that I didn't prepare. Well, I used to talk about it in advance to try to help people get accustomed to the fact that I'm weaning you off of therapy. So I would decrease the days that I'm seeing you, and then I would try to help them to understand, or I would say it often. And then I found that saying it often doesn't help. It makes it worse when you get ready to leave that person, depending on what their cognitive status is. Like the people who have dementia or Alzheimer's, they may not recall. But the ones who are lucid, they will remember. And I actually had someone to do something to themselves to keep me. And so that taught me not to give advance notice. So now I let people know probably closer to the end, maybe within the same week, that you're doing really well. This is the progress you're making because I'm seeing this progress, and it means that you're now more independent. You can do things on your own. You don't need to see me that often. But I do always hold the door open, and I try to say, like, if something should happen, you can still see me. However, I wish you all the best in being as independent as possible. So, um, just shortening my time in telling the person that they are being discharged has been more beneficial for me.
I'm gonna try that approach. Yeah, I didn't think of it that way. If you give somebody notice, then it's like all of a sudden, well, now my back
Something's wrong.
hurts, or my
Yeah.
elbow. What if my elbow? Or I can't go. And I'm like, no, but you was just fine
Right.
5 weeks ago. So, yeah, yeah, that's a very good way to put it. And then do you accept insurance? Do you accept Medicare?
Yes. So we accept Medicare Part B and TRICARE insurance, and those are the people who will say that something's wrong.
Yeah, especially
And
private.
we also accept private pay too. Yes.
Gotcha. Yep, that's it. Now, you are doing something wonderful, giving back to the community, giving back to physical therapy students, with covering the costs for them to take the NPTE, especially if they didn't pass on the first try. So,
Mhm.
what inspired you to do that, and what are the application requirements for someone to get that scholarship?
So I graduated physical therapy school, but I did not get my license right out of physical therapy school, and so I know the plight, the concern that a person may have, not just the financial one, but the social emotional ones and everything like that. And so I wanted to create a scholarship that helped people in the intermediate or the limbo area between I've got my degree, but I'm not yet able to practice. And it's not what people tend to think that they just didn't study. Sometimes people just aren't great test takers, but you still know your information and you're able to be great therapists down the road. And so I just wanted to be able to help someone through the I Can't to I Can Perseverance Award. It's open to anyone who has already taken the NPTE, but you haven't been successful. And it's a 2-minute video that's required, and you can submit your application through a form that leads you to a link that you can upload your video. But we just need proof that you have um, sat already, but you also have a current test date coming up with your ATT letter, as well as you will also get not only the fees that you've paid for that exam, but the state licensing fees, the prometric fees, all of those that are related to it. And then the physio trivia game, because you got to have that fun aspect of studying. And the Final Frontier, NPTE Final Frontier, has also teamed up with us to be able to provide a review course for anyone who is interested.
Play with you. I'm not about to play. What? That is, oh my gosh. Yeah, that's so needed. I need to team up with you. I got to do something to help people. Oh my goodness. No, that's wonderful. That's wonderful. And tell me, are you going to the National Association of Black Physical Therapists conference this year in June?
I did not sign up for it. I know it's coming up in June. I might attend virtually.
I need you in person. I need you in person. We're gonna come together. We're gonna agree now. Yeah, no. Oh,
Mhm.
physio trivia, love physio trivia. I want to have a game night the day before the conference. So that's
Okay.
in the works. That's what I'm trying to plan with my girls, yeah, and all that good stuff for the just for preparation for the conference. But I will spread the word on I can't to I can
Thank you.
scholarship to get people together because yeah, it's so many things you have to focus on. And if you don't pass on the first try, you got to worry about financial things. Now it's emotional. It's so many different things. So if somebody
Mhm.
can help, alleviate some of that pressure on any sides of if it's financial, if it's emotional, that is really helpful. So thank you. Thank you. I like it. Thank
Mhm.
you, Dr. James. And I'm not going to take up too much more of your time. How we end every episode is we talk about a test that we went through that led to a testimony or a test that we're currently going through that's going to lead to a testimony. So if you could touch on that for a little bit.
Business wise, I think initially I was doing a lot of trying to reach out to establish the name, limbs, and things, and to be able to tell people that we exist. And now I don't do that. And I'm grateful that people just are able to reach out and communicate with us and get on our schedule. And we be able to really help transform people's lives from I can't do it to I can. And I'm just grateful that when I ask God to help us with an influx of people, that He does it. And not to say that God is a genie, because He's definitely not, but being able to seek God for the things that you need is definitely a vital aspect of who I am, but it also spills into the business as well. But I will say that I think it's important that as you establish your business, that you think about all of the ramifications associated, because when you're in physical therapy and healthcare in general at the top of the year, people tend to go see their primary care physician. They'll go see possibly their dentist. but they don't see their physical therapist until usually later on in the year. But we've been blessed to have like a cyclical cycle where we're able to see people year round and not have that lack that we had at the beginning. So year one in January and February being kind of ones that we needed to take a break because there was nothing going on. People weren't actually referring to physical therapy or we didn't have the staff, but now we do. And we have the opportunity to see people starting in January. So I'm grateful for that.
All right, now, Dr. James, thank you for blessing this episode. That was a wonderful episode, and thank you for sharing all of your knowledge with us. I'm excited to collaborate and see you at that conference. Uh, so, thank you all for listening. This was another episode of Testimony Thursdays. Make sure to like, comment, subscribe on our YouTube at Testimony Thursdays and Instagram and TikTok at Testimony Thursdays, and then my personal page, Dr. Jasmine Blocker, on Instagram and TikTok. And Dr. James, do you want to share your information as well?
Sure, and thank you for having me. Limbs and Things is online at Limbs and Things LLC on Instagram and on Facebook, or you can follow us for a pull up with Limbs and Things every first Saturday at Limbs and Things LLC on Facebook or on YouTube as well. Thank you.
Thank you all. See y'all next week.